Hey everybody, this is Jonathan with House Call Physical Therapy or House Call PT. I forgot to mention in my last video, I'm new to this. I've been a physical therapist for the last 17 years, treating patients in their home, and I've had my own business where I treat patients again in their home for the last 6 years. So I see different types of people, different illnesses, different mobility issues, different disorders. You name it, I've probably seen it. And what I want to discuss today is I got a lot of people asking me, you know, my knee really hurts, my hip is really bad, should I get a knee or hip replacement? And my answer is, well, if your life is truly infected, where your quality of life is lower, then yes, you should have it. But they're like, oh, well, my neighbor said that her friend had a knee replacement and it's not good, it still hurts. Well, everybody's different, and you don't know what that other person went through, or if she even followed through with physical therapy or instructions from her doctor. But I can tell you this, I definitely agree that if you are very limited in your mobility and you have lots of pain and you're not moving the way you should get a hip and knee replacement. Hips and knees are the most advanced replacements on the market today. But the number one thing that you need to consider if you do with it, you need to make sure that before you get to surgery, that you try and exercise and do what you can to get your mobility up. Which means that if you're not walking, you need to still try and walk. I know you're going to have pain and discomfort, but you're going to get a knee or hip replacement. It doesn't matter. The more strength you have, the more endurance you have, the recovery will be easier. Okay? I had it done. Actually, I'm only 43 and I had my hip replaced. And I still walked up a treadmill. I still walked uphill. I still worked out. And I was back to work in 2 weeks. Now it's different. I'm a physical therapist. I'm a little bit younger. But that's the biggest thing that I could recommend, is make sure you do what you can to be as active as you can before the surgery. Then after the surgery, make sure you follow your doctor's orders and participate in physical therapy to get your strength, mobility back. It's very important. Now, if you guys have any questions, feel free to email me at housecallptaz@yahoo.com. I'd be more to answer any emails that you guys have. You can ask me questions on this YouTube channel. But if you like it, please subscribe. I'm going to try to be posting weekly videos about different problems that arise, or how to combat different illnesses and what you can do through my experience and what I've seen. So again, if you guys are considering a hip and knee replacement and it's definitely bad, mobility is infected, you're in a lot of pain, your quality of life is not what it should, then yes, I would agree that you should get it done. Do your research. Find a surgeon that is board certified and doing hip and knee or lower extremity only. Do not go to a surgeon who says, oh yeah, well, I can do shoulders, hip, knees, feet. That's not good. The more surgeries the doctor has under his belt, the better outcome you're going to have, because if he runs into a problem, he's probably seen it before. So again, if you get hip or knee replacement surgery, make sure the doctor is board certified and only does hips or knees. That's a specialty. Do not go to a doctor that will do your shoulder, your rotator cuff too. You want to just make a doctor to only specialize in hips and knees. Sorry, I'm getting used to talking on camera. I apologize if I'm saying the wrong words sometimes, but I really appreciate your support. So if you guys have any questions, you can email me or ask me on my YouTube page. This has been Jonathan Pauly, physical therapist, House Call PT. Thank you.